Hello, I'm Dr. Bruno Martins. I'm an attending physician of the Division of Endoscopy of the Cancer Institute of the University of São Paulo. First of all, I would like to thank all my colleagues who support me to conduct this study and gastrointestinal endoscopy for giving us the opportunity to discuss this article here. The article is about the adverse events of esophageal stents in patients with malignant disease and long-term survival. So self-expandable metallic stents are considered by many experts as one of the best treatments for malignant dysphagia. However, little is known about the occurrence of adverse events in the long term. So as nowadays chemo and radiotherapy has achieved a better control of the disease, patients has improved the survival. It's always a matter of debate what is the optimal timing for putting a stent in a patient with a better prognosis. So should we place the stent right now or should we postpone it as long as possible and treat the patient with alternative modalities like surgery or budgeting, etc. We reviewed our stent database and included all patients palliated for malignant dysphagia who remained with the stents in place for more than 6 months. So we included the 63 patients with a mean follow-up of 10.7 months, and 40 of these 63 patients presented adverse events. Some patients had more than one adverse event, so we had a total of 62 adverse events, which included ingrowth, overgrowth, fistula formation, migration, bleeding, pain, and other minor complications. So as you could see, although we had a high rate of adverse events, most of them could be managed by endoscopy. Precisely 84.5% of the adverse events could be managed by endoscopy. We had only 3 fatal complications. So 2 patients who had an esophageal respiratory fistula who died from pulmonary sepsis, and 1 patient who died because of tumor bleeding. So this graph shows the cumulative survival of patients who had adverse events, as you can see in the blue line, and the patients who had no adverse events, as you can see in the green line. Patients who had adverse events survived longer than patients who had no adverse events. This is probably explained because patients who survived longer had more time to experience the adverse events. But it also shows that adverse events had no impact on decreasing mortality. So what are the conclusions we take from this study? So first, adverse events is a common complication in patients with long-term staining for malignancy. However, these adverse events are usually minor complications that can be managed by endoscopy without impact on mortality. Our data suggests that esophageal stents is a valid option for patients with malignant dysphasias, even for patients with better prognosis who are supposed to live longer than 6 months. Usually we see these patients in clinical visits as outpatients, and routine endoscopies are not performed unless recurrence of dysphagia is suspected. Once again, I would like to thank all my colleagues and gastrointestinal endoscopy for discussing this article with you. Thank you.